often have men sitting in the chair right across from me, and they'll lean forward and lower their voice almost as if they're about to confess something. They'll say, "Doctor, the mechanics are fine, but the feeling just isn't there. It's like the signal is getting lost between my brain and my body." And I nod because I know exactly what they're describing. They aren't talking about desire, they're talking about a disconnect in the nervous system. And it's one of the most common, yet most unspoken frustrations in men's health. Today, we're going to talk about a specific spot on your body, a critical junction of nerves and blood flow that most men completely ignore. And I'm going to show you a very simple, safe, and private technique using a tool you already have in your bathroom cabinet that can help wake up that connection almost instantly. Before we get into that private conversation, I want to ask you a small favor. This channel is a labor of love. It's my way of extending my clinic hours to you. If you find value in respectful, evidence-based health conversations, please hit the like button and subscribe. It truly helps other men find this space. I am also looking at adjusting my posting schedule to make sure I'm here when you need me most. So, in the comments below, let me know where you're watching from and tell me, are you watching in the morning before work, late at night, or during a quiet moment in the afternoon? Let me know, and I'll make sure the next video is waiting for you when you're online. For those of you who are new here, I'm Dr. Claire Weston. I am a board-certified urologist, and I've spent over a decade specializing in men's reproductive health, hormonal balance, and prostate wellness. In my practice, I see men from all walks of life: executives, athletes, new fathers, men in their 20s who are worried about performance, and men in their 70s who, why I created this channel and how you can help, want to maintain a vibrant quality of life. Over the years, I've learned that medicine isn't just about prescribing the right pill. It's about listening. It's about understanding the anxiety that comes with feeling like your body is betraying you. I approach men's health with precision, but also with a deep sense of empathy. There's no judgment here. Whether we are discussing erectile function, low testosterone, or prostate concerns, my goal is to give you the anatomy lesson you didn't get in school and the practical tools you need to feel confident in your own skin. So, let's get into today's topic, which is essentially a lesson in nerve anatomy and how to stimulate it for better blood flow. To understand the how, we have to first understand the where. There is a specific zone on your body called the perineum. Anatomically, for a man, it's the flat area of skin located exactly halfway between the base of the scrotum and the anus. Now, why is this tiny patch of skin so important? Because it sits directly above a convergence point of critical structures. Deep beneath the surface of the perineum lies what we call the perineal body. And just beneath that, running through the pelvic floor, is the internal pudendal artery and the pudendal nerve. Think of the pudendal nerve as the main power line for sensation and function in the genital region. It carries the signals that allow you to feel pleasure, and importantly, it helps regulate the blood flow into the erectile bodies of the penis. For an erection to occur, you need two things: a signal from the brain to relax the smooth muscle, and a massive influx of blood through arteries like the internal pudendal. However, modern life is hard on this area. We sit for hours on end in cars, at desks. This compresses the perineum. It crushes those delicate nerves and blood vessels against the chair. Over time, it's like putting a kink in a garden hose. The flow isn't as strong. The nerve signals become dulled. Many men focus only on the shaft, which is the end of the pipeline. What I'm asking you to do today is go upstream and address the source. By gently stimulating the perineum, we can send a rich wave of blood flow and neurological energy towards the penis, improving the rigidity and quality of the response. I've had patients come to me frustrated that medication wasn't working as well as they'd hoped. And when I explain this vascular and nerve compression and we start addressing the pelvic floor and perineum, they often report a significant improvement in the fullness of their erections. So, why a toothbrush? Why not just use your finger? This comes down to the science of sensory stimulation. The skin of the perineum is relatively tough, but the nerves beneath it are incredibly sensitive to specific types of touch. Using a soft bristle brush provides a diffuse, gentle, sweeping stimulation that is very different from the deep pressure of a fingertip. Think of it like this. If you want to wake someone up gently, you wouldn't shake them violently. You might draw the curtains to let in light or gently brush their arm. The bristles create a showering effect of sensory input. They stimulate hundreds of superficial nerve endings simultaneously. This flood of sensory information travels up the pudendal nerve to the spinal cord and brain, triggering a reflex that encourages the anatomy lesson. Where is the perineum? Smooth muscle in the penile arteries to relax. When that muscle relaxes, the vessels open up and blood rushes in. It's a form of non-invasive neuromodulation. We are using physical stimulus to wake up a nerve that may have gone numb from years of compression and neglect. This is also a wonderful technique for men dealing with what I call performance anxiety. When you're anxious, your body is in fight or flight mode, sympathetic nervous system dominance. This shuts down blood flow to non-essential areas. By gently stimulating this area, you are encouraging the rest and digest parasympathetic state. You are telling your body it is safe to relax. It is safe to let blood flow here. All right, let's walk through this step by step. This is a clinical protocol, so let's treat it with the respect it deserves. I suggest doing this in the evening in private when you are not rushed. For preparation, take a brand new unused soft bristle toothbrush. We do not want bacteria from your mouth near this area. Designate one specifically for this purpose and wash it with warm, soapy water before and after each use. Lie down on your back on a comfortable surface. Your bed is fine. Bend your knees and let them fall open slightly. This relaxes the pelvic floor. If you prefer, you can lie on your side with your top knee drawn up. Next, take your clean finger and find the raft. This is the visible line that runs from the base of the scrotum back to the anus. The perineum is the flat, smooth area in the center of that line. You are looking for the spot that is halfway between the genitals and the back passage. Now for the technique itself, take the soft bristle brush with the gentlest pressure imaginable, literally just the weight of the brush. Begin to brush in one direction only. From the base of the scrotum, sweep the bristles backward across the perineum, stopping before you reach the anus. Lift the brush and repeat. We are not scrubbing. We are not massaging in circles. We are performing a feather stroke. This trains the nerve to recognize sensation in that specific direction, the direction of natural blood flow. Do this for 60 to 90 seconds. You might feel a very subtle warmth or a deep tingling sensation. That is the nerve waking up. If you feel pain or sharpness, you are pressing too hard. Lighten up immediately. After 90 seconds, put the brush down. Close your eyes. Just breathe. You may notice a spontaneous sensation of fullness or a pulling sensation deep in the pelvic floor. That's blood starting to move. At this point, if you are with a partner or engaging in self-stimulation, you will likely find that the response is quicker and the erection feels more rooted and vascular. I had a patient, a 48-year-old cyclist, who came to me with numbness. He started this technique 3 times a week. He reported back after a month that while the instant effect was interesting, the real benefit was that the general sensation throughout the day had returned. He felt more connected to his body again. Before we wrap up, I need to address some crucial safety points. First, this is for soft bristles only. Medium or hard bristles can cause microabrasions, which can lead to infection. Be gentle. Second, this is a tool for nerve stimulation and blood flow, not a treatment for underlying disease. If you have a complete lack of erections, if you have pain, or if you notice lumps, you need to see a urologist. Third, I see a lot of misinformation online suggesting that you need to pound or strike these areas. That is dangerous. You are dealing with delicate neurovascular bundles. Aggressive pressure can cause bruising or injury. Gentle, consistent, respectful stimulation is the key. We are coaxing the body, not demanding from it. Your body is incredibly intelligent. It wants to function correctly. Sometimes it just needs us to pay attention to the parts we've been ignoring, the backstage areas that support the main event. Taking ownership of your health isn't about aggressive routines or quick fixes. It's about learning your own anatomy, treating it with kindness, and understanding that sensation and blood flow start long before the moment of arousal. They start with posture, with relaxation, and with simple habits. If this video provided a new perspective for you, please share it with a friend who might need to hear this. Men's health shouldn't be a solitary struggle. Let's continue this conversation in the comments. Let me know if you try this technique or if you have questions about the other unspoken parts of male health. Don't forget to subscribe so we can stay connected on this journey. I'm Dr. Nora Hayes, and I wish you a healthy, connected week ahead. Take care of yourselves.